The shortcomings of the transcutaneous stimulators using surface electrodes, percutaneous wire electrodes, and surgically implanted multi-channel stimulators are overcome by the BION technology. BIONs have potential application in prosthetics. BIONs are wireless electrical devices that can be implanted in muscles that require stimulation. They are powered and controlled via radio waves from a small external controller that can be worn by the patient. Within a device of the size of a long grain of rice is an integrated circuit chip sandwiched inside an antenna coil. The BION is implanted non-surgically with the use of a 12-gauge intricate hypodermic needle. As a minimally invasive technology, BIONs offer an advantage over functional electrical stimulation systems that require surgical implantation of a stimulator or that apply electrical currents at the surface of the skin. BIONs enable therapists to apply currents directly to one or more muscles at widely varying levels of intensity. BIONs are injected and not implanted, and they could remain permanently in the body even after therapy is no longer indicated. When the capacitor electrode of the BION is fully charged, a discharge of that electrode through a controlled current source produces well-controlled stimulation pulses of any intensity, able to stimulate a peripheral nerve or even a relatively large muscle. BIONs can be modified to produce direct currents, which are being used in experimental methods to promote the regeneration of soft tissue, nerves, and bone. They serve as a flexible means for introducing electrical currents in many forms of treatments. The first BION devices had a length of about 16 mm and diameter of 2 mm and were energized solely by inductive coupling with an external large coil fed by high currents. Later BION devices have a length of 27 mm and a diameter of 3.3 mm and contain a rechargeable battery that is charged by means of inductive coupling. BIONs have been tested in stroke patients at risk for shoulder subluxation. After they were implanted into the two shoulder muscles that pull the shoulder into the socket, electrical current was supplied in 3 15-minute sessions per day to prevent muscle atrophy and excessive stretching from arm weight. The clinician would then send the patient home with a transmission coil placed over the shoulder region and a simple control box that would store up to 3 different exercise programs that the patient could administer while reading or watching television. Typical improvements in shoulder joints after several weeks of treatment included enhanced voluntary movement of the shoulder muscles in some patients. Such stimulation may promote plasticity of the brain and, at a minimum, encourage patients to use muscles that would otherwise be too weak to be functional. 4 generations of BION technology are now either in clinical trials or under development. All are designed to stimulate myelinated sensory or motor axons, typically in peripheral nerves or muscles. BION Type 1. These are RF-powered, continuously controllable stimulators. These are used for therapeutic electrical stimulation. BION Type 2. These are RF-powered, continuously controllable stimulators and sensors. These are intended for ambitious research on functional electrical stimulation to reanimate paralyzed limbs. BION Type 3. These are rechargeable battery-powered, programmable stimulators. These are designed primarily for electrical stimulation to modify neural activity in a dysfunctional pathway. Example, urinary urge incontinence. BION Type 4. These are rechargeable battery-powered intercommunicating stimulators and sensors. These are being developed for applications that are beyond feasibility for low-frequency RF-powered BIONs. The first RF-powered injectable microstimulator was successful in overcoming the problems associated with RF-powered multi-channel, multi-wired functional electrical stimulation devices, which were electrical surgery, infection of large continuous implant surfaces, RF-powered device problems, like maintaining proper orientation of the power transmitting antenna with respect to the implant, and also the discomfort of wearing an antenna and a battery-powered transmitter, lack of coordinated sensors and stimulators. Most functional electrical stimulation systems require one or more sensors in different parts of the body to coordinate or trigger a specific stimulation pattern, and requirement of extensive advanced planning. Each stroke and paralyzed patient has different degrees of paralysis and partial degrees of freedom. Each condition usually requires a unique sensor system to coordinate or trigger a unique stimulation system. This situation requires advanced knowledge of a lot of factors like the number of stimulating and sensing channels, the length and termination of each channel wire, and the type of sensors and signal conditioning required.
Following are the applications of BIONs. Retraining voluntary hand use in stroke patients. Treatment of obstructive sleep apnea. Conditioning muscles around the knee in osteoarthritic patients. Preventing bed sores by activating gluteal muscles. Stimulating and promoting healthy urination and bowel movements by assisting with gastric emptying and respiratory clearing.